Thank you so much for the intro, and thank you to the Greenberg Academy for having me back. So, welcome back to everyone who is joining us this week. And if you did not attend last 2 weeks ago session, welcome for the first time. I'm really happy to be here. My name's Nicola, and I'm an HSS physical therapist, and I'm excited to talk about falls prevention today. And I have nothing to disclose. So last time we talked about an introduction to falls. We talked about some risk factors for falls, balance, and the importance of physical activity, and we ended with an exercise session. Today, we may have a bit more talking today because I wanted to address some of the questions that had come up at the end of the session last week. We're going to be talking about bone health, about gait speed or walking speed. We'll be talking a little bit about visual and vestibular systems of our body and how that relates to balance and falls risk. And then I want to spend the bulk of the time talking about some falls prevention strategies that you can use. And again, we'll finish up with another exercise session today. So, bone health. So, you may have heard of osteoporosis. It is a condition that develops when the bone mineral density decreases. And this can weaken your bones. And it's often called a silent disease because many of us have it and we don't know that we have it until we have a fall and break a bone. Most of our bone is built up when we're younger and it peaks at about age 20 and then it declines over time as we get older, especially for women post-menopause. And it's quite a common condition to have. Up to 30% of women post-menopausal can develop osteoporosis, but it also affects men as well, especially men over the age of 70. Um, and it's associated with an increased risk of falling. Individuals with osteoporosis do have an increased risk of falls, often due to muscle weakness or spinal kyphosis, bending forward at the spine, or decreased postural control. It's also associated with an increased risk of having a broken bone or having a fracture, and due to low bone mineral density and weaker bones. And the hips, the spine, wrist are the most susceptible bones to suffer an osteoporotic fracture. It can also result in the fear of falling, and along with this, restrictions in your activities of daily living due to this fear of falling. So it can be, it can have some pretty big effects of your life. So how do we manage it? There's no one size fits all to managing osteoporosis, but in general, maintaining a healthy lifestyle is really important. Making sure you're having a healthy diet, getting enough calcium and vitamin D, and there are also certain medications that you can take that can help slow bone loss. So, bisphosphonates or hormone replacement therapy for postmenopausal women. This has been shown to slow the rate of bone loss and even increase bone density. So, it's something that you can talk to your doctor about. In general, from a physical therapy perspective, exercise, multimodal exercise, AKA doing a lot of different types of exercise, is one of the best things that we can do for our bone health. So, strength training in particular is one of the most effective ways to maintain or improve bone density. When we lift something heavy or pull a heavy band, we're stressing our muscles, which pull on our bones. And this can stimulate your bones to adapt and become stronger. So, what we often don't get right, I think, is that you need to do fairly challenging strength exercises. So, the protocols from all of the studies show strength exercise done 2 or 3 times a week. 2 to 3 sets of somewhere between 8 and 12 repetitions of a particular exercise that has to be done at a moderate to fairly strong intensity. So 70 to 85% of your maximum strength. That's what you should be working at in order to stress bones. If you're doing like really light exercise, it may not be enough to strengthen your bones. So this is something that you can talk to your physical therapist about, providing the appropriate strength program for you. But strength training is one of the most effective strategies, not only to improve your bone health, but to also improve your risk of fracture as well, and falls. So improving your skeletal muscle, like your arm and your leg strength, the size of your muscles, the strength of your muscles, as well as the power of your muscles. So high velocity, AKA faster power muscle training. Once you have a strength foundation, you can start doing quicker movements because we lose power of our muscles. So the ability to forcefully contract a muscle, AKA get you up and out of a chair, Sorry, I may have gone out of screen there. Um, Power of your muscles is really important for safety as well. This decreases faster as we get older. So this is something, again, you could talk to a physical therapist about. Weight bearing activities, so walking, dancing, pickleball, those are anything that you're putting weight through your feet and through your legs that can help stimulate bone in your legs and through your spine. So weight bearing activities as opposed to non-weight bearing activities like swimming or cycling. Weight bearing activities can be really helpful for bone health and balance training. So that's what we're here for today. So doing exercises that can help you improve your balance. It's all good exercises to do for osteoporosis and bone density. Gait speed is something I wanted to talk about today and touch on. So walking speed. Did I go? There we go. Walking speed. Slow walking speed is a risk factor for falls. So walking less than 1 meter per second has been shown to be a risk factor for falls. Um, a decline in your walking speed also. So if you've noticed that over the past year or so that your walking has become slower, even if it's not at that threshold of 1 meter per second, it's still worthwhile checking in with your doctor or your physical therapist because a decline in your walking speed is also a risk factor for having a fall. So if you've noticed it, or if you've noticed one of your loved ones has started to slow down, encourage them or yourself to talk to a doctor. The visual system. So, the visual system is a very important system for maintaining our balance. Last week, we talked about how your proprioceptive system, it's your joint position sense of where is your body in space, your visual system, and your vestibular system all play an important role in maintaining balance. So, our visual function declines with age. Your lens of your eye anatomically becomes a little bit stiffer, so it's harder to adapt. And uh, our visual acuity or our contrast sensitivity, our ability to detect motion, they all decline as we get older. Poor vision does lead to increased risk of balance issues and increased risk of falls. So it's important to get your eyes checked by your doctor. Using multifocal lenses can also affect your balance risk because it changes how we see it. It looks kind of different when you look one way when you look down versus when you look up. So having like bifocals or multifocal lenses can affect your vision and your balance as well. So um, check in with your doctor. Okay, cataract surgery, if you have cataracts, has been also shown to help reduce risk of falls. The vestibular system. So, the vestibular system is a set of specialized organs in our inner ear and up into our brain that helps us detect movement of our head. So, especially when we're turning, and it helps us to detect kind of where we are in space. So, if you're like looking left and right to cross the street, or if you're moving forward and back, it tells us like velocity of our body. Um, and dysfunction of the vestibular system can cause things like dizziness, vertigo, disequilibrium, tinnitus, which is a ringing in the ear, can cause instability, especially if you need to make like a sudden turn, like if you're turning over in bed. And vestibular dysfunction as well is something that also increases with age. Now, I want to comment that there are many different types of vestibular dysfunction, and it can range from something benign, like there's this thing you may have heard of BPPV or benign paroxysmal positional vertigo. Um, to something severe like a stroke. So there's so many different things that can cause issues with your vestibular system. So it's important to make sure that you are checking in with a doctor or a vestibular specialist to know if you're experiencing any of these symptoms, what specifically is causing your symptoms, because there are very specific tests that can be done to determine the cause of your symptoms. And the specific treatment approach will depend on those underlying causes and to each person's unique presentation. So there are physical therapists who specialize in vestibular rehabilitation, and they can perform certain tests and measures to determine the specific exercises that can help, because vestibular rehabilitation is something that has been shown to help with certain vestibular issues. So if you're experiencing any of these symptoms, go get it checked out. So now to the bread and butter and the meat and potatoes of this presentation, I wanted to talk about falls prevention tips. So if you or your loved ones feels like you're at risk of a fall or have a fear of falling or seems unsteady, please talk to a healthcare provider. Um, Schedule an appointment with your doctor. Keep a list of like an updated list of medications and supplements that you're taking and discuss them with your GP or your pharmacist. Discuss any side effects that you may be experiencing, like feeling dizzy or sleepy, and make sure that you're taking the appropriate supplements and medications to help you deal with your symptoms. Also, talk to them about your diet and nutrition. Are you getting enough fluid intake? Are you staying hydrated enough? That's really common, especially if we're experiencing things like incontinence. Sometimes, or in the summer when it's really hot, we get dehydrated. So make sure you're getting enough hydration, because that can be a falls risk factor as well. Making sure you're getting a diet sufficient in appropriate vitamins, minerals, and nutrients to make sure that you can maintain bone and muscle and nerve health. It's really important. And a lot of us, as we get older, don't have a diet that supports our best body function. You can also, as I mentioned, make an appointment annually to see your eye doctor to make sure your vision is doing well and you have the appropriate eyewear. So I wear contact lenses and glasses, and it's important for me to make sure that I'm checking up every single year to get anything updated if I need to. You can also schedule an appointment with a podiatrist or for a foot assessment. You can ask your GP for a foot assessment, but a podiatrist is also a foot specialist. So they can evaluate your feet and treat or manage common foot problems like pain or swelling or sensory issues like neuropathy, for example, if you have diabetes, circulatory issues, or things like corns and bunions and calluses. All of these things can affect your balance and can affect your risk of falls. They can also evaluate your footwear, make sure your shoes are fitting properly. Things like when your shoes are too big, that can increase your risk of tripping and falling. But also, if your shoes are too small and tight, your foot can't adapt to the floor very well, and that can increase your risk of falling too. So they can check your footwear, make sure it's appropriate. And if needed, they can prescribe you orthotics if they think that that might help with your balance as well. I can't stress this enough. Being aware of your surroundings is so important with your balance. Falls often happen at home, and sometimes we get lazy about our home environment, but it's really important to know where you are, where your body is relative to your environment. Where are you in relation to tripping hazards, such as pets or kids or toys belonging to pets and kids? I can't tell you the number of times where I've had patients who came in who told me they tripped on their kid left out a toy train or something like that, or their dog or their cat caught around their feet and then they tripped on their pet. They're very big tripping hazards. I've tripped over my own toddler because they just run around underneath you and you don't see them down there. So it's really important if you're playing with grandkids or if you have pets to know where they are at all times. When you're out in the community, if you're out walking, it's really important to be aware of your environment, knowing where you are in the street. Did you just walk out into a bike lane? There's bikes that zip by so fast now. Know where cars are and cabs and other people walking down the street. Being aware of if it's icy or if there's uneven pavement or going up and down curbs, being aware of that kind of outdoor environment is really important too. When you are moving, it's important to move mindfully. Take your time with transitional movements. If you've been lying down, for example, when you get up really quickly, that can sometimes make you feel lightheaded and that can make you feel dizzy and lose your balance. So, doing a little body scan and just checking in with yourself when you're sitting up, are you feeling okay? Then getting back up to stand and making sure that you're feeling steady on your feet. Take a few breaths if you need to, take a pause, take your time. Um, Using technology. Technology is here to help us. So things like assistive devices around the house, like reachers or grabbers. Never, ever, ever climb on a chair or a table or a cabinet to try and reach something from a top shelf. It's not worth it. Use a grabber or ask someone for help, okay? Um, it's such a big risk for falls. Things like life alerts or phones, they can also be really helpful, especially if you are alone. If you have a fall, something like a life alert can alert someone that you've had a fall. Obviously, we want to avoid falls, but if it happens, you want to make sure that you're prepared. So, phones, there's technology in phones now to detect if you have had a fall, and it can alert someone to provide help. Um, If you have a cane or a walker, another piece of technology, I know it can be kind of humbling to use a cane or a walker, but it's really important to use it. Not only to use it if you've been prescribed it, but to use it correctly and to know how to use it correctly. I've seen people who have supposed to be here with a cane or crutches or a walker, and they're just holding it under their arm. And it's not very useful when you are holding it under your arm. It has to actually be used correctly for it to help you keep your balance and prevent falls. All right. So that's my big PSA about that. And finally, asking for help. Get your friends or family involved or ask a healthcare provider. Asking for help is really important if you need it. If you're nervous of falling and you want to stay active and you don't have anyone to walk with, there are walking groups out there as well, like walking partners even. And I think it's becoming more common to go out kind of in groups for going for walks to stay active, but also doing it in a safe way. So help is really important. Other ways to ask for help, you could go through your rooms at home, going room by room to with a family member or friend or loved one, or even a physical or occupational therapist to make sure your home is set up in a safe way. Um, you can make sure that you don't have any like tripping hazards around your house. Speaking of tripping hazards, clear your clutter. You don't want to slip on anything like an old newspaper or pile of papers or a dog toy or something. Make sure that your floor is fully clear of things that are not meant to be on the floor, okay? Especially at the top and bottom of a stairwell or in hallways or in the bedroom or somewhere where you're likely to trip and fall on it, okay? Speaking of, keeping your house well lit. Double check that your lights are all working, have working bulbs, and they're set at their brightest setting. Um, you can always inspect your home and make sure that you are aware of any dark areas and put lighting or improve your lighting situation if you are able to. You can install night lights for in the bathroom or hallways at night or in your bedroom. And you can install motion detection night lights as well if you have to get up and pee in the middle of the night. It's really important to make sure you have a well lit house so you're not fumbling around in the dark and tripping and losing your balance because that's a common risk of falls as well. Footwear at home. Don't walk around your house in socks. I think I mentioned this last session, but I have fallen when you're walking in socks. It's so easy for your leg to slip out from underneath you, especially on carpet. It's very slippery. If you hate shoes and you don't want to wear your shoes inside, you can get some slipper socks or like some grippy socks on the bottom. And that will help you with grip when you're walking around at home. Other tips. You want to make sure that all of your rugs and carpets are firmly attached to the floor and that you don't have any edges coming up. Even the slightest little edge can be a tripping hazard. So you want to make sure that they are secured with double-sided tape or no slip strips if needed. And just make sure that you are taking extra care for rugs, like in the bathroom and the hallways where it's a common place to trip, okay? Um, I've personally tripped on the tiniest little bit of a carpet that had come up from the floor, and I fell pretty hard, and it was not fun. So it can happen to anyone. Make sure your electrical cords, again with the clutter, electrical cords out of the hallways and out of common walking areas. They're a really big tripping hazard. Um, Rearrange your furniture so that nothing's blocking your path. You don't want to be having things that these are all very preventable things that you can do to manage your falls risk at home. Check on your furniture. Is anything broken or unsteady? Is there like a loose nail or loose screw in one of your chairs? Nothing should be wobbly or on wheels because that is not stable. So these are things that you can check in with like a loved one to go through your house and do a safety check, or as I said, a physical or occupational therapist. There are also people who can help you rearrange your items and put commonly used items at a lower shelf so you're not having to like reach, so they're easily accessible. And if you have any questions, the CDC has a really great home safety checklist that we'll be providing, and it goes kind of room by room of what you can do and strategies that you can take to check in on your house and some actionable items that you can take. One of the questions that I had from last week was, how do I get more confident about falls risk? And I didn't really have a good answer of how to be more confident about falls risk, but I think for me, knowing the risk factors, knowing where my weaknesses are, and knowing my home environment and my outside environment, and then taking and knowing what steps I can take to minimize any risk, I think that's the most empowering for me. So that was kind of the best answer I could come up with for you, is just try to give you as much information um, to empower you to make the changes that you need to decrease your risk. And hopefully, what we've talked about today, you're empowered to go talk to one of your healthcare providers about any issues that you may be experiencing.